Hello, this is Dr. Shah from SSP Health. This is a short message about the importance of picking up signs and symptoms of cancer early and informing your doctor to ensure that we can pick up any potential cancers and treat them so that we can cure them sooner. Now, there are various parts of the body in which cancer can occur, and we'll start from the top and gradually work our way down of the most common types of cancer that we may come across. Now, if you experience a very unusual headache that you're not normally used to, and the headache worsens if you lie down, or you have double vision, or you are vomiting profusely associated with the headache, then this is a potential cause for concern, and you may need to speak to your doctor about this. Yes, it's true that patients with similar symptoms who suffer from migraines may present to the doctor, and your doctor can then advise further and treat accordingly. However, if left untreated, if the symptoms were to become worse, then obviously it may potentially delay treatment. The other things to mention are, for example, if you were to have problems swallowing, if your food was starting to stick, and if you were losing weight unintentionally, this could be a potential sign of esophageal cancer, and it requires further investigation. So it's important to let your doctor know if you are losing weight unintentionally. If you are coughing and your cough persists beyond 3 weeks, or you are coughing up blood, these are signs of concern, and you must contact your GP to consider arranging a chest x-ray to look for any potential problems. If you notice that you have got blood in your urine that is persistent, usually blood in the urine is most likely due to a urinary tract infection, which requires a short course of antibiotics, and that may solve the problem. However, if the symptoms persist, then it's important to discuss these with your doctor so that they can refer you on for further investigation to look for the underlying cause. In the same way, you can have vaginal bleeding, particularly in women who have finished their periods, as in gone through the menopause. If they were to continue having vaginal bleeding, this is a cause for concern and requires further investigation. It's very important to speak to your doctor about these symptoms. And lastly, blood in the stool or blood from your back passage, and associated with the change in bowel habits. If you have loose stool persisting for beyond 3 weeks, for example, this may be a cause for concern and requires further investigation. Yes, it's true that although the majority of the time when patients present with such symptoms, it may not be cancer, it may be something else that your doctor can advise you for and treat accordingly. However, it's important that if you do detect any potential signs of cancer, then you seek help early, because the earlier we detect that cancer, the more likely we are to be able to cure it. Thank you very much.